And we've been asked about surgical outcomes for children who have Down syndrome and they have, on top of that, heart conditions. So could you give a little bit of information about the numbers and the types of surgery and the outcomes, if at all possible?
Yeah. In our care of children with congenital heart disease, we care for an awful lot of children who are born with Down syndrome. In a population who have Down syndrome, probably about 45% of them are born with a congenital heart defect, and some are more serious than others. We now in the current era have very good results for the surgical outcome of children with the most common kind of heart problem that's associated with Down syndrome is a condition called a complete atrioventricular septal defect, which is a problem that causes holes between both the upper and lower chambers of the heart, and also abnormalities of the valves leading between the atria and the ventricles. The outcome for that surgery has improved very much since I first started working in pediatric cardiology, and in the current era, we would expect that patients with Down syndrome, more than 95% of them would come through their surgery successfully. And then beyond that, usually have a very good quality of life from the cardiac point of view. Some will require further surgery in later childhood or teenage years. But we find that with the children with Down syndrome, that for their heart condition, the most important period is usually the first 6 months of life when they do have symptoms, but beyond that operation, then they have the potential to do very, very well. And we follow many of them in our patient care.
Thank